report paints a dire picture of a lack of access to mental health resources in Knox County. According to the Mental Health Association of East Tennessee, access to care is far worse than originally thought.
Raya Gatene explains what those in the field are saying needs to be done. Raya, good morning.
Good morning, Abby and Heather. This is the report right here. It shows that in Knox County, the demand for mental health care has dramatically increased over the course of the pandemic, but unfortunately, access to it has dropped. More than half of people who need help with their mental health just aren't getting it. According to the Knox County State of Mental Health Report, more than 200,000, roughly 40% of people living in the county are dealing with some sort of mental health issue.
The pandemic has certainly made things different because it's driven more people to identify, number one, they have a mental health treatment need, and then two, to determine that they need to seek help.
Those seeking help, however, are now far outnumbering professionals who can provide it.
Our providers, while good, may not have enough clinical staff to be able to see people in a timely manner or as quickly on a follow-up visit.
That's partly due to a workforce shortage and staff turnover.
And it's hard to recruit people into that sector, and you've got more people seeking help. That's a huge problem.
Another problem, Harrington says, is the lack of resources available specifically for people of color.
We don't have enough Black mental health professionals. We don't have enough folks that speak Spanish.
These challenges are impacting both public and private providers. Fewer than 10% of private professionals in Knox County are taking new patients.
More people are experiencing increased depression, anxiety, stress.
One of the solutions, Harrington says, is working with organizations like the McNabb Center, a public and free resource providing mental health care for people of all ages and backgrounds.
In the past 2 years, we've seen double the amount of individuals trying to access care.
Last year, the center helped around 37,000 people in East Tennessee.
I would love to see more funding for therapists.
In the report, more funding is listed as one of the recommendations moving forward, along with developing a talent recruitment pool.
We need to try to recruit people to the field and recruit people to choose Knox County, Knoxville, Tennessee, over other communities.
But that's only part of the solution. Hiring more Black and Spanish-speaking mental health professionals, funding a psychiatric emergency room, and partnering with Knox County schools to provide young people with better access to care are all on the list.
We know the problems. Now let's work together to address some of these concerns.
Now, the report comes as Governor Bill Lee has asked for a $4 million behavioral health urgent care center right here in Knox County. The city and county bought the building on Woodland Avenue a few months ago using COVID relief funds. Officials say their goal is to turn it into a walk-in center to fill a gap created by the closure of facilities at Lakeshore and the old St. Mary's Hospital. The proposed money from the state would help support it, and Mayor Glenn Jacobs says many currently seek help at hospitals where they experience long waits and high costs.
The hospitals do their best, but that's not what they're equipped to do, and it ends up being very expensive, and the folks don't get the care they need.
And the mayor says it'll take about 18 months to renovate the building. So obviously a very complex issue, and it's going to take a lot of collaboration from a lot of different entities, as you just heard, in order for the county to move forward.
This is such an important thing, especially coming off of the few years of COVID.
Yeah, now more than ever, people need this kind of help.
Exactly, and that's what the report is trying to highlight.
Thank you, Raya.
All right, we're checking in with Mike on that forecast.